controversial. I think we can all agree that this is a very supportive thing for reproductive health care for women. And why? Because contraception, prescription contraception, is used for purposes of birth control as well as medical reasons. This bill is a great support for women, and I'm going to tell you why. I'm going to make the business case, the support case, and I'm hoping that you're going to vote with us today. As you notice from the bill, it's going to direct insurance companies to actually allow women to get their prescription contraception, birth control pills, rings, those kind of things that are activated by hormones that prevent ovulation, to get those for 6 months at a time. Right now, many insurance companies limit that to 1, but no more than 3. That means you have to go back to the pharmacy over and over and over. And we know women have busy lives. We're raising our kids, we're caring for our husbands, we're working for adults in our homes, we're volunteering, we're doing all kinds of things. This would help us. Why is it important? Because birth control doesn't work unless it's taken regularly. So if you increase access, you increase adherence, and you increase effectiveness, right? This is a great thing. Now, some people have said, we don't like to interfere with business. I get that. We do not want the heavy hand of government to reach in and tell businesses and manufacturers and so forth what to do. But in this case, it's the lightest touch. And here's why it's necessary. Many times, as you know, in the market, if there is a competitive product being, exchanged, that if one company were to do one thing a little different and they'd reduce the cost, everybody would jump to them and it would destabilize the market. And so in this case for insurance companies, we need a stable, predictable marketplace. And so the insurers might just need a little nudge to say, everybody offer it at the same time. We're all going to jump at once. Because if one insurer does it on their own, there might be a destabilization of the marketplace. Now, I mention that because the insurers are not opposed to this bill. Probably because it's so cheap, so inexpensive, and to basically, if you think about some of the other costs associated with getting your prescriptions refilled over and over and over, every time that prescription gets a script or a refill, there's somebody else charging an administrative cost, right? So we're actually going to decrease some costs by only going to the pharmacy twice a year instead of 12 times a year. Now, the important thing to know also in Idaho law, we can do that up to 13 months. The pharmacy rules allow. I'm only asking for 6. This bill has come before this body before. The first time I brought it, it was 12 months. And the body said, no, that's too long. So the second time I brought it, I made it 6 months. And the body said, okay, and they passed it out of this wonderful chamber. So then you must ask, why did it fail? I don't know what happened on the other side exactly, but I think it was miscommunication. But we got it so far. And I'm here again to get it out of this chamber and through to help women in our state. I do want to mention also, in the process of doing this, I did meet with Right to Life groups, and they were concerned with emergency contraception. And they said they would not oppose it 2 years ago when I did this if I put that in the bill, and so I did. So if you read it clearly, I have responded over and over to people's concerns, and they are in there. If you're a first-time user, you can't get a prescription for 6 months. You got to go through the regular process until you're on it to get your meds right. And then, so that's in there too, okay? So I am asking you today, please, and I want to mention one more thing. 25 states have actually adopted this policy at 12 months. When I brought this bill just 2 years ago, it was only 20 states. So we are doing better. I'm asking us to be 26. Please, y'all, I'd ask for your support. And with that, Mr. President, debate is open.
Is there further debate? Mr. President.
Senator Leahy.
Thank you, Mr. President. Senators, I've been here a while as well, and I've been consistent. I appreciate the bill's sponsor. I know that this bill is very well intended. I support women. I love one in particular, but I won't go down that road. But I do my best to support women.
Stop digging.
Senators, as I said, this is a very well-intentioned bill, but just because something is good and something is convenient doesn't mean that the state needs to mandate it. I do believe in the lightest touch of government, and I don't think a mandate for convenience is the lightest touch of government. I've talked with family members and friends who happen to be women, and they have a 3-month supply under their insurance for blood pressure medicine, for diabetes medicine, and those medicines involve seriously life-threatening conditions. And they're responsible. They go get their prescription every 3 months, or they get it in the mail, and they take care of it. I don't think birth control should be treated differently than these other medications. It's a matter of responsibility every 3 months. And if that's what your insurance provides, then that's what you do. If this is really a good thing and there's a high demand for it, then let's let the free market take care of it. I am one that says, yes, I acknowledge we regulate business in certain contexts, but I don't think we need to mandate in this context for convenience. If it's a good thing, the free market can implement it. So again, out of consistency, senators, I will be voting no.
Is there further debate?
Mr. President?
Senator Horde Ingle-King.
Thank you, Mr. President. And I just wanted to share with the body, I've been really lucky and I haven't had to take a lot of medication in my life, but last year I was put on some medication to lower my cholesterol, and without any question at all, I received a 12-month supply. So I think many medicines, my husband's high blood pressure medicine, are given in a year's supply. So I think we should be in line with that. I think it would be helpful to women in this state.
Is there further debate?
Mr. President,
Senator Trayco.
to debate in favor of the bill.
You have the floor.
Thank you. I can only share with you my personal experience with this. I am stuck in, I shouldn't say stuck in, my insurance provider is through the federal government, through TRICARE. I receive my medications through the VA. I currently receive a 6-month supply of my medications, and I think it's great. And the VA also does allow supplies up to 13 months for certain medications, so on and so forth. And that gives me a great medical freedom to not have to worry about, are they going to arrive in the mail in time or not? But what I would like to say is my wife is a type 1 diabetic, and we are dependent on the mail system and her 3-month supply to arrive to us. And this is a life-saving medicine when you're a type 1 diabetic, in case you don't know the difference between type 1 and type 2. Type 1 does not produce any insulin whatsoever. And so it can only be regulated through this insulin. Many times we have dealt with not receiving medications or the prescriptions not properly going through. And once again, this is the federal government that runs all my systems, so it might be different than the private sector. But however, we've been forced to go to the emergency room at times because we have no insulin. And we're dependent on this 3-month supply. I would be excited to see something like this go to all medications, be an option for 6-12-month supply. Would need it not be. But I would just like to say, I understand we don't like to regulate private business, private commerce, or something like that. We have a free market system. However, we also have individuals that we have promised, many of us in here ran on medical freedom for individuals. And so this is an opportunity for those to get medications that'll last longer, not have to worry about being chained to only a 3-month supply and being worried when that 3-month supply is running out, are they going to receive their medication on time? If they're planning on going on a vacation, can they get ahead a month's supply in time? 6 months, I think, is pretty low, and that really gives them a lot of time to plan out. It's half the year. So I would just like to say, it's not necessarily do we hate business, do we hate commerce. Do we hate people? It's none of those matter. What the issue is do we want to afford people that availability for that option, convenience, and in life-saving, well, in this case, it deals with contraception, so I'll stick to that. In this case, being able to plan accordingly for long distance of time. So with that, I urge you to take that in consideration and vote aye in favor of this bill. Thank you.
Is there further debate?
Mr. President.
Senator Rutke,
Thank you, Mr. President. To debate in favor of the bill.
you have the floor, Senator.
Thank you, Mr. President. I am also a believer in free markets. I think that they work best when we let them work out the frictions and problems that come along with a market-based system. There are some exceptions to that. And I would say that all states, including Idaho, have decided that the insurance industry is just one of those industries that you can't just leave to the free market. I don't know exactly why, but in my job as an attorney, I end up reading a lot of insurance policies, so I suspect the reason is because insurance policies, they're complicated. If you've ever actually taken out your automobile policy or your health insurance policy or whatever it is and read it, they're difficult. They refer to other sections. You have to have read the whole policy to truly understand what each section might mean. So they're really complicated. Sometimes they're written in such a complicated way that I think even the insurance companies get lost in their own language. And what does that mean for the consumer? It means you end up getting lost in their being lost. And as consumers, because we don't have expertise in reading these policies and understanding the language that they use, I think oftentimes we just assume the best about what they're doing. But if you've ever had a claim denied or you've ever been unable to get something covered that you truly felt needed to be covered, you know how frustrating that can be. And so the state of Idaho, like all states, has decided that the insurance industry cannot just be left unregulated, that it needs to be regulated. Everybody's familiar with our code books. This is Title 41. Title 41, just by comparison to some of our other code books, there's 3 titles. In this book, it's half the size. Just Title 41 here. This is the insurance title. This title covers everything insurance, everything from what you have to do to become an insurance agent, sell insurance. It covers what unfair settlement practices are in Chapter 13. Chapter 18 tells you how to make a claim against your underinsured motorist coverage. And the title goes on in excruciating detail for this reason. In fact, the state of Idaho has established an entire department of the state government called the Department of Insurance. So, I agree. Where we can, we should let free markets fix the problems that exist in free markets. But there are certain industries that need to be regulated, and this is just a tiny drop of an increase in a little bit of regulation, and it's one that the insurance industry, as you've heard, welcomes. Thank you, Mr. President.
Is there further debate?
Mr. President.
Senator Guthrie.
Thank you, Mr. President. Senators, of course, when you're around for a while, you get a chance to see the same issue come up over time, and I can tell you that this is at least the 3rd iteration, and I've always supported this effort. And I guess I look at it as not just a benefit to women. It's, I think, a benefit to healthy relationships. And when you look at the application for medical needs other than contraception, I think it starts to make sense. And you're talking about adolescent girls on up to all women. So it has application well beyond that. And I think, the convenience alone probably justifies the opportunity to afford a little bit more flexibility. When you look at industry and you look at whether you want to regulate the private sector or not, I don't remember in any iteration of this bill industry coming in and opposing. They have recognized that that's a small benefit, and we see insurance companies and carriers all the time that they try to targets areas where they think they can be a better service provider for their consumers. I think that it's maybe just one small convenience that makes a lot of sense on a variety of fronts, and I would urge your support.
Is there further debate?
Mr. President,
Senator Den Hartog.
would the senator from 19 yield to a question?
Senator Wintrow, do you yield?
Mr. President, I yield.
The senator yields.
Thank you, Mr. President. Senator, it's not quite on topic, but as I'm sitting here, I'm wondering, do you know if insurance companies currently cover vasectomy procedures?
Senator Wintrow.
Mr. President, yes.
Mr. President, to debate in favor of the bill.
You have the floor.
Mr. President, Senators, similar to my colleagues here on the back row, we've seen this issue. I appreciate the changes that the sponsor has made over the years. I wasn't comfortable at the 1 year when we saw this on the floor several years ago, and then working with some members of our pro-life community, addressing the issue with the emergency contraceptives. I think this is a good bill. I think it supports our families in Idaho, and I urge your support. Thank you, Mr. President.
Thank you. Is there further debate?
Mr. President, to debate the bill.
Senator Foreman, you have the floor.
Thank you, Mr. President. First of all, I know that this bill is very well intentioned. I've spoken with the author and I understand the concerns, but let's look at the free market aspect of things. You know, we talk about a light touch or government intervention. You know, if the issue involves an overarching concern for public safety and the state feels compelled to step in because of that concern for safety, then government intervention in the private sector, I say yes at that point. But for personal convenience, no. The private sector is the private sector. It needs to be left to handle its own issues, as long as we're not looking at an issue that is so dire with respect to public safety that we have to step in. The 6-month supply versus 3-month supply, I admit that sounds like a good idea, but if it is a good idea, why isn't it happening? Why don't the customers go to their insurance companies and demand this type of increase in the service? That's the way the private sector works. The government shouldn't step in unless it's absolutely necessary. And in terms of, yes, we regulate the insurance industry. That's because at times we have to, in the interest of public safety and fairness. But we don't have to regulate any industry to underpin what is basically just personal convenience, matters that can be worked out through the normal market processes and through free enterprise. So I'll be voting no on this bill. Thank you, Mr. President.
Mr. President?
Senator Lee.
Thank you, Mr. President. To debate in favor of the bill.
Go ahead.
Again, we've talked a lot about free market. I would ask each one of you, how many of you have been able to go to your insurance company and ask for something to be changed? How many of you are dependent upon your employment for what kind of health insurance you and your family have? This is a regulated monopoly in this state. So I think to argue that we have a standing, that's why we have, as the good senator from 29 said, we have a whole division. We've got books. And I wish that after we've had all these conversations this many years, that our insurance companies had come forward. We've had some really significant debates previously on hearing aids for children, and they just stepped forward and did it. We didn't have to legislate that, but clearly we're going to have to set policy for this. So I resist the free market analogy with our insurance providers. And I do think that this is a spectrum of opportunity for women at all ages. And those who are concerned about this, I would offer to you, there are other ways to make these things convenient by not having them be prescribed. That is not what this is we're not offering that. We're saying that this is a prescription and that there are a lot of different needs. But good senators, consider, those of you who are not female on this floor, have the option to get your birth control at any gas station or convenience store any day that you would like to. That is free market. That is your access. Men and women are different. That's okay. This is about access, and it is about convenience, but it is also about ensuring that there is some parity in this. And this is one step forward. It is not a high-cost prescription. It is not going to be onerous for these insurance companies. And finally, good senators, I would ask that you support this step forward.
Is there further debate? Hearing none. Senator Winthrop, you're recognized to stand and close the debate.
Thank you, Mr. President, and thank you, senators, for the lively debate on Senate Bill 1234. I'd like to thank each senator and basically share some points about what is made today. And Senator from 23 talked about the responsibility in free market, and as we've heard again, when we think about why the insurance companies won't do this on their own, I don't know for sure. But it is up to us to make value decisions, to give them a little nudge, because I do think in the marketplace, if everybody jumps at once, it stabilizes things. But if one person goes first, that may create destabilization and increase costs for the insurance companies. That's my hypothesis, and I'm sticking to it. Senator from 18, thank you so much. You acknowledge that some prescriptions do get at least a year, and so why not be equitable about that? I appreciate that. Senator from 11 mentioned the VA allows, talked about his prescriptions. The VA actually allows 12 months of birth control for their folks. I'm only asking for 6. He mentioned his wife's diabetes. I have a relative who is type 1. And she had other complicating factors of health, and the physician suggested she not have kids because it could kill her. And so she used birth control for a while. And then she finally decided on her own, as she could, that she wanted to try. And she went off. And it did almost kill her. Now, she went back on birth control after that. But I want you to remember, some people can't have kids and they're advised that way for their health. Now, they could choose to do it. I don't judge that. But that's why it's so important to get your meds on time and have that increased access for adherence. And that does provide more freedom in our lives, especially if we're traveling, all those kind of things, then it will reduce the risk of missing it. Senator from 29, thank you for mentioning the fact with the very nice visual that we have an entire Department of Insurance that regulates this. And again, this is the tiniest little thing. I was just saying, and a very affordable thing. They're not even opposing it. Everybody jump at once and let people get up to 6 months if they choose. They don't have to, but if they choose, if their lives depend on that. Appreciate the senator from 28 recognizing that birth control for women is not just helping them, helps everyone, helps our families, and it helps with family planning. Appreciate the question from Senator from 22. Indeed, vasectomies are covered by most insurance companies. And by the way, it's pretty easy to get Viagra, even though we're talking about birth control, and that's a little bit different. But you can go online and talk with a pharmacist and get it shipped right to your door. And I tried to do that for contraception. There's a few companies out there in states that you can do that. Not in Idaho, not available, because you have to have a prescription. Shouldn't have to have a prescription, honestly, because it is very safe. Over the years, we have decreased the amount of hormones in each pill and each ring. It is so much safer now. So hopefully one day we won't need a prescription, but right now the state of Idaho, we do. Again, I acknowledge the senator from 6 and his advocacy for the free market, but once again, lightest touch. And I've heard this issue about convenience. It's more than convenience. Some cases it's about life and death. Some cases about if you have to prevent the pregnancy. It only works if you can adhere to it, right? So all I'm saying is let's increase that access. Senators, I don't want to have to talk about the subject again. I am asking for your support. A tiny thing we could do for women that would make a big difference in their lives. Mr. President, debate is closed.
The debate being closed, the question before the Senate is, shall Senate Bill 1234 pass the Senate? The Secretary will call the roll.
Adams. Anthony. Burnt. Bierke. Burtenshaw. Carlson. Cook. Den Hartog. Foreman. Grow. Guthrie. Harris. Hart. Hartkin. Herndon. Just. Lakey. Lee. Lenny. Lind. Nichols. Okonowitz. Robbie. Ricks. Ruckty. Schroeder. Simoroff. Taylor. Taves. Trakel. Van Orden. Ordingle-King. Winder. Wintrow. Zeiderveld. Adams. Bierke. Lent.
The vote count shows 19 in favor with 16 against. A majority having voted in the affirmative, Senate Bill 1234 has passed the Senate. Hearing no correction to title, the title is approved and the bill will be transmitted to the House.